Good morning to everyone. This is myself M. Seshasai Durga, working as Assistant Professor in the Department of Pharmaceutics. Here today I want to explain a topic. I would like to explain a topic that is Drugs and Cosmetics Act. Drugs and Cosmetics Act 1945 and its rules 1945. Okay? Under the subject of pharmaceutical jurisprudence. Right? So, in this pharmaceutical jurisprudence, before going to the syllabus, actually first we should know what is juris and what is jurisprudence, how it is related with the pharmaceuticals. Okay. So, first thing, juris. Juris means nothing but laws. Okay. Laws which are related with the pharmaceuticals is combinedly we can call as pharmaceutical jurisprudence. So, first we should know what is the definition of that jurisprudence, why, how it is useful in our pharmaceuticals. See here, laws which are intended to regulate and control various aspects of social life like social, economic, political, etc. So, here pharmaceutical jurisprudence means actually before the 1940s, at that time we don't have in our India, we don't have a specific healthcare system, a proper healthcare system in our India. Okay, so before the 1940 means in the ancient India, at that time what the people are using, how the pharmacy is there and how the people are using the medication, how they are taking the medication, that one we will discuss in the introduction part of this pharmaceutical jurisprudence. So coming to here, actually before the 1940, at that time the people are using the medication, they are preparing the medication from various sources like vegetable sources, animal and mineral origin. And also who will prepare the medication? Generally some people who are having some experience in the preparation of the medication, they only used to prepare the medication, they only used to sell, distribute, everything will be done by only one person. Okay, and he is not a qualified person, there is no a particular qualification for the people. Generally with the experience only they are going to manufacture, sell, distribute, everything will be done by only one person. And also here the preparation, how the medication is preparing. Okay, that medication, the preparation of that medication is kept as a secret in the family of one person. So, only that procedure will be carried out by the remaining people in the same family. So, it is from one generation to another generation it will be transferred. Next, coming to our syllabus. In this, under this pharmaceutical jurisprudence, we have different types of acts. So, in that first one is Drugs and Cosmetics Act 1940 and its rules 1945. Before the 1940, how will be the healthcare system? I already discussed with you, and after that 1940. So, once the Drugs and Cosmetics Act was established in the 1940, then what will be the primary healthcare system in India and what will be the procedure or field of pharmacy in the India, that one we will discuss in the under this topic. So here under this 1940 Drugs and Cosmetics Act, these are the contents about all these we will know here. First one objectives, next one definitions, next one import of drugs and next one manufacturing of the drugs. So, first we will see what are the objectives, why the Drugs and Cosmetics Act was established. These are the objectives here. First one, to regulate the import, manufacture, distribution and sale of the drugs and cosmetics in our India through licensing. I already said to you that before establishment of this act, Drugs and Cosmetics, before the 1940, there is no specific rules and provisions for the pharmacy. Generally some experienced people only used to manufacture, sell, distribute, everything will be done by only one person. But when the act is established in the 1940, then completely the provisions, conditions, regulations, everything relating to the pharmaceuticals are changed. So here some objectives are framed by the Drugs and Cosmetics Act. What are the objectives? We will see here. import, manufacture, distribution and sale of drugs through the licensing. So, to proceed for the import or manufacture or distribution or sale, to do all these activities, the people must and should gain a license from the licensed authority. So after getting that license only, they are able to prepare or they are distribute, they can able to manufacture, sale, everything they can do after getting the license from the licensing authority only. And next one, manufacture, distribution and sale of cosmetics by qualified persons only. This is most important thing, qualified persons. We previously what we discussed before the 1940, there is no a specific qualified person for the pharmacy. Only generally the experienced people are used to manufacture, sell, distribute. But under the after that pharmaceutical legislation, when the act is established, then completely the procedure is changed in our India. So a particular rule was passed by the act. What is that rule? The rule is qualified persons. So to sell or to manufacture or to distribute, to do all these activities, the person should be a qualified person. Okay, qualified person. So qualification is mandatory. And next one, to regulate the manufacture and sale of Ayurvedic, Siddha and Unani drugs. Not only the allopathic drugs, under this Drugs and Cosmetics Act, the Ayurvedic, Siddha and Unani drugs, the sale, manufacture of these systems are also regulated by the Drugs and Cosmetics Act. And next one is to establish the Drugs Technical Advisory Board, that is nothing but DTAB, and Drug Consultative Committee, that is DCC. Okay. So these two are DTAB and DCC, these two are the administration of the Act. So some objectives are framed under the Act. To fulfill the objectives, to achieve the objectives properly in a good manner, definitely we need some administration. So for that administration, these are the boards, DTAB and DCC. DTAB means Drug Technical Advisory Board and DCC, that is Drugs Consultative Committee. So these two are the administrative bodies under the Act. These two bodies will regulate the remaining objectives of the Act, and also these two bodies will give suggestions and they will frame the rules, they will pass the rules under the Act to achieve the objectives. Next, coming to the definitions. So definitions means some of the important terms. These terms we are used from starting means from the first unit to last unit until completion of the pharmaceutical jurisprudence topic. We are using all these terms, commonly we will use. So in that one, first one is the drugs.